I have a 10-year AA survivor, anaplastic astrocytoma, with a history of seizures, but otherwise lives her life accordingly. I mean, she is a clown at a hospital for kids. She's a wonderful mom, has 2 sons that are going to college now, has been controlled for years on 1 seizure medication. The insurance now that she has had for years decided that they're not going to pay for brand name anymore, that they'll pay for generic. And it was a significant difference a month for her to pay for her brand name only medication. So what we usually do, and for those that don't know about generic medications, especially with seizures, you have to be very careful because of how the generics are made, and you have a higher risk of having seizure if you're converting from a brand to a generic medication. So we weaned her off because she wanted to try it. We weaned her off appropriately using we would use the generic and the brand alternatingly so that we can try to preserve her from not having a seizure. Anytime you change a med. She had seizures. She tried the generic, had seizures. We had to up the dose, still had seizures. The insurance company we went back to, we tried to appeal it. They denied it. They denied it twice. So Dr. Landolfi got on the phone, denied it again. So she had to go on now 2 generic medications instead of 1 medication that was controlling her. But it's cheaper for her per month, and that's what the insurance company's looking at, the cost that they're paying out. So again, we went through the appeal process and it just didn't work. There's usually a paper appeal, and then there's a phone call appeal, doctor to doctor peer review, and that didn't work either. And then there's a 3rd form of appeal. We went through the 3rd process, but again, she didn't. So appeals don't always work.